Hello friends, in this time of pandemic when corona has hit us hard, the scenario and functionality of the whole world has changed, and the same change is seen in India too. Though the Indian government is trying their level best to control the spread of the disease, still the total number of cases has crossed the 1 lakh mark. So without further delay, let's dive into data. Thermal screening of incoming international passengers from China and Hong Kong was started on 18 January, much before the first case of coronavirus was detected in India. On 13 January, the first coronavirus case was confirmed in Kerala's Thrissur district after a student who had returned home for a vacation from Wuhan University in China tested positive. In Feb 4, Kerala declares coronavirus a state calamity after a third case tested positive. On February 11, the World Health Organization named the novel coronavirus disease COVID-19. India witnesses a sudden rise in the number of coronavirus cases from March 4. It now stands at 29. All public gatherings banned in Kerala and classes were suspended. In March 11, WHO declares coronavirus a pandemic. From March 13, Karnataka, Odisha, Punjab and Manipur government announced that all schools in the state would remain closed till March 31. Similarly, all the states started announcing the same. Bollywood singer Kanika Kapoor, who returned from London, tested positive in Lucknow. As the number of coronavirus infected people in the country crossed 324, millions of Indians observed a Janata curfew on Sunday. Heeding to Prime Minister Narendra Modi's advice, he proposed the curfew as a part of social distancing to check the spread of novel coronavirus. PM Modi also urged for an exercise during the curfew to express gratitude to the personnel who are providing essential service amid the COVID-19 outbreak. As India intensifies its fight against the new coronavirus disease, reports emerged of flight crews and doctors' harassment by neighbors and flight associations. The cops are playing a major role in this tough time. They are vulnerably exposed to the rising COVID-19 infections. Even then, they are guarding the containment zones and enforcing the lockdown. PM Modi announces a 21-day lockdown in the country in a bid to contain the spread of novel coronavirus. Modi asserted that social distancing is the only way out for the country right now. All transport services, road, rail and air were to remain suspended during the lockdown. Centre also made an allocation of Rs 15,000 crore to strengthen health infrastructure in order to contain COVID-19. In March 26th, an Indian preacher who was part of Tablighi Jamaat congregation at Nizamuddin Markaz in Delhi tested positive and dies in Srinagar. Due to lockdown, all industries stopped working and thus leaving no way out for daily wage earners to keep up with their living. And so many started moving back to their homes on foot. This created a lot of pressure on the government to make these people reach home safely, and thus Delhi government opened the Anand Vihar bus terminus, which made the situation much more chaotic. On March 30, as Kerala records 213 cases, which led to the national total of 1,071 cases, out of which 14 deaths were recorded. Till April 3rd, 102 people tested positive in Tamil Nadu, 93 more cases in Delhi, 44 additional cases in UP, 67 new cases in Maharashtra, while Madhya Pradesh case count went up by 47. On April 5th, the entire country switched off their lights and lighted diyas, candles and mobile flashlights from 9 p.m. for 9 minutes in their balconies to mark the country's fight against COVID-19 pandemic and to show solidarity to those affected by the virus and thank everyone involved in the essential services. In April 7th, the death toll in India crosses 100 mark. The Kerala government has introduced many innovative measures which help the state to contain the disease. The Health Minister of Assam, Himanta Biswa Sharma, left no stones unturned by putting forward different measures like building 2,000 bed large quarantine centers in its stadiums and collaborations between private and government hospitals. Similarly, different states has tried different measures to contain this disease. PM Narendra Modi extended nationwide lockdown till 3rd May with a conditional relaxation from 20th April for the green zone areas. Indian government also launches Araygo Setu app on April 14th to track coronavirus infections developed by the Nation Informatics Center, and that comes under the government Ministry of Electronics and Information Technology. India sending hydroxychloroquine to 55 coronavirus hit countries. Hydroxychloroquine, an anti-malarial drug, has been identified by the US Food and Drug Administration as a possible treatment for COVID-19. On April 20th, Uttar Pradesh Chief Minister Yogi Adityanath's father, Anand Vish, died on Monday and was cremated in Haridwar at a funeral which was not being attended by the CM, who said he is duty-bound to stay in his state. On 1st May, the government of India extended the nationwide lockdown further by 2 weeks until 17th May. The government has divided the entire nation into 3 zones: green, red, and orange, with relaxations applied accordingly. The economy is going to recession and the government is opening the business activities phase-wise so that the earnings are not blocked. Also, Finance Minister Nirmala Sitharaman has launched economic packages of rupees 20 lakh crores to boost the MSME sector, and also said that some non-strategic PSUs will be privatized, which will help in employment generation. In this pandemic situation, various celebrities and industrialists like Ratan Tata, Ambani came forward and also contributed in PM Relief Fund. As the lockdown is extending day by day, our Mother Nature is also healing. The water conditions of various rivers like Yamuna and Ganga are becoming better as there is no industrial work going on. Due to less air pollution, the air quality index of various cities like Delhi are becoming better. Now we are at the 4th phase of lockdown. The recent data says that it took India, the second most populous country in the world, 64 days to cross the mark of 1 lakh total cases, while many developed countries like USA, France, Italy crossed the mark within lesser days. At present, there are over 5 million coronavirus cases in the world, among which above 3 lakhs are deceased. In India, over 1,12,000 confirmed cases are there, among which about 64,000 are active and over 3,400 are deceased. India's recovery rate is 39.6%, while the death rate is 3.1%, which is much lesser than the world average. And this shows that for a developing country with mass population to lead a way out for the whole world of how the first action can cause the least destruction. So in these tumultuous times, as all of us are locked up in our homes with nothing much to do, anger, helplessness and despair does start to creep in. But didn't we always want this break? Always screaming about how we have no time to relax and chill? The dinner tables that were always empty are now full of laughter and mindless chatter. We are going back to our long forgotten hobbies and exploring new passions. We are growing together as family. So let's take this golden opportunity to do something productive and spend time with our families, because who knows when we get this chance again. Now as the lockdown is getting relaxed to some extent, we must ensure that proper social distancing norms are followed and to go out only when necessary. We should wash our hands regularly and take proper care of our kids and elderly members. We should respect those who are fighting for us during this pandemic so that we can someday tell our future generations that we also helped in this fight against coronavirus by staying at home.